cancer patient going into the hospital, if they are diagnosed of having breast cancer, there would be a specific chart for all breast cancer. It's kind of like a one-size-fits-all approach.
We prefer to do what we call the tailor-made treatment for each patient. Nearly every kind of cancer we have to judge properly. That we need to set up some kind of the what we call the excellence center in cancer treatment and also cancer research. We bring physicists, surgeons, oncologists, pharmacologists, pathologists all together. At the moment, we gonna move forward to what we call the precision medicine or genomic-based therapy.
Genomic guided cancer treatment, or in a bigger picture, genomic guided cancer care. This includes even prevention, monitoring, diagnosis, as well as the treatment itself.
The tumor mass will be resected by the surgeon and send that mass to the pathology. We are the pathologists, we examine that tumor and make diagnosis, what type of tumor, how advanced, what the stage of tumor. We like a bridge from the basic to the advanced technology.
Genomics is a field of studies. We're studying is a DNA sequence. We know that cancer originates from our normal cells, and this cell transforms into a different one. Almost all of them caused by the genetic code alterations. Breast cancer, for example, two different persons that have the same breast cancer indeed could have a totally different genetic alteration, or a genome technology could elaborate as and understand more how those differences from one person to another.
Once the sequencing facility finish their work, the data usually comes to me in maybe a big hard drive. My groups are the one who handle data processing and analysis and put those data together and interpret the result into the landscape of cancer in Thai population.
Each ethnic group have uniqueness. The way that we perform the analysis is by taking specimen from the patients themselves after surgery. We culture it in the laboratory. After 2 to 4 weeks, we are able to grow and expand the specimen and try to put in the drugs that we may give it to the patient later on down the road, 4 to 10 different kind of drugs, but in the dish. Because of this possibility, we can determine whether that individual would respond to the treatment or not. The overall goal about the System Pharmacology Center is that we want to bring the novelty in terms of diagnostics and the treatment, and helping to become the bridge between the scientific world and the clinical world, translating the knowledge into practice. We bring to this table the ability to predict ahead of time what choices of drug that the clinicians, after they see the genomics report, which one of them would be most efficient and having the least side effect to each individual patient.
I know maybe because usually computer works very fast, so when I have to work with a lot of people, usually they have their own pace and maybe things doesn't go as fast as I want it to be, but we need to keep adjust to this situation as well.
We kind of work together to fill the gap. We always have a strong point and weak point. We always have different opinions, but if the different expertise and also the opinions work together, those would synergize and have a better impact.
For me, working with different people is not the obstacle. I have learned something different, kind of expand my knowledge.
One of the reasons people leave what they are doing and then come together to join the force is the burning needs of the better quality of the treatment. And I think that now we are getting better and better. and a lot of people are joining and start to understand and enjoy the benefit of the working team like this.
If you get the best technique, if you get the best treatment, but it just limit to a few patients, it's no point. We have to make sure that this kind of technology have to be able to apply to everyone equally. So everyone will be able to get the benefit from our attempt, from our effort.